Mr. Kling,
Hey,
good to see you today.
Good to see you, Dr.
John Kling is 72, a semi-retired financial planner. He's a pretty healthy chap. This visit to UAB neurologist Dr. David Geldmacher is designed to keep him that way.
I have a family history of dementia and Alzheimer's, so I was very interested in seeing, what kind of risk profile that I may fall into, if any.
Kling was one of the first patients at UAB's new Alzheimer's Risk Assessment Clinic. His mother and her 4 sisters had dementia. Geldmacher, who treats dementia patients as the head of UAB's Memory Disorders Division, sees a lot of caregivers like Kling who are worried about their own risk.
I was spending a lot of my time in the care of people with memory loss, advising people without memory loss how to protect themselves. And that told me there was a need for this kind of service.
The clinic provides a detailed risk assessment, including a family history, cognitive tests, neurologic exams, and for some patients, an MRI scan.
It's about an hour-and-a-half process of collecting a detailed risk factor history, and we focus on the reversible risk factors. So many people facing the risk of dementia focus on the irreversible. I'm getting older. My dad or my mom had dementia, and we can't change those things. But what we can change are things like levels of physical activity and cholesterol counts and blood pressure numbers.
Each patient gets a detailed plan on how to reduce their risk that is based on 20 years of research. Geldmacher describes a hypothetical patient with 3 modifiable risk factors.
If she reverses one of 3 things, loses weight so that she's not obese, brings her cholesterol under control, increases her physical activity, or brings her blood pressure into the normal range, she can cut that risk in half. And if she manages 3 of those reversible risk factors and brings them all into the desirable range, she can cut her dementia risk by half again.
For John Kling, the news was good. His risk is low, and Geldmacher's recommendations for keeping it low include healthy behaviors that he was already doing.
The physical activity of walking and actually working with light weights and those types of things I've done for years, but it really was a reinforcement that, hey, you're doing the right things.
Kling likes knowing his risk, and he now has a baseline to gauge changes that might come as he ages.
So the peace of mind and knowing that we have this type of help in our own backyard right here in Birmingham, Alabama, I think is fantastic. So it's great to have the professional help that Dr. Geldmacher and the program that he has that provides this risk assessment, I think is invaluable.